Well, joining me via Skype is Julie Mogbo, Director of Family Health and Lead Nurse Africa International Foundation. Julie, I must lend my voice and my hands as well to say thank you and everyone else out there that have been contributing to help curtail the spread of COVID-19 across the world, across Nigeria, and even Lagos State. Thank you so much. We appreciate you all. Thank you so much for your effort. It is obvious now that healthcare workers are very, very vital to the society, especially with regards to issues like pandemics like this. Julie, talk to us about the challenges health workers are facing at this point.
Thank you very much. The challenges that health workers are currently facing, especially as we battle the pandemic, is something for everyone, all stakeholders, to pay critical attention to. Reason being that their roles are pivotal in curbing, in managing and containing the spread of this pandemic and then putting a stop to it altogether. If their safety, their health aren't taken into consideration, we might have too much than we can manage. Some of the challenges that they are facing, first of all, has to do with the facility in which they work. When this whole pandemic broke out and it was apparent that Nigeria had recorded the index case, and there was a need for everyone to pay attention and be on guard, there was the fear of how ready we were as a country to combat this pandemic. How prepared are the facilities? The norm in many facilities before now is to manage equipment, manage materials, borrow from one word. So there weren't enough equipment. So that was the fear. We have received so many calls of those who are afraid and want to resign and all that. Will they have their jobs back? So they had the fear of whether we were adequately ready for what is coming, even till now. Because as it is, there just might be a surge. Are we prepared? Are we ready if there happens to be a surge in this pandemic here in Nigeria?
Julie, it seems that Nigeria is not the only country that is witnessing a shortage of personal protective equipment across the world. Every country is witnessing that. And so some countries, some states in Nigeria are beginning to look inward. That aside, is it just the provision of this personal protective equipment that is the need of healthcare workers? Some have said perhaps we look at the mental states because of the fact that they engage with persons who are ill, and some have to see those persons who die, persons who they cared for eventually die, and that has an impact on their mental state.
Yes, it does. So I was going to get there. We have the physical preparation that has to do with the personal protective equipment, the readiness of the facility. And then we also have the predisposing factors. Now, the individuals themselves, the health workers, those that have conditions already, pre-existing conditions that could expose them to this virus, those that are battling maybe asthma, they have heart conditions and all that, they have that to deal with, and they find themselves in the front line. And then their mental state as well. I have to be at work. We have those that are working 48 hours straight. We have those that are doing 24 hours, those that are doing 12 hours, depending on the demand. So there is fatigue that is creeping in, that is taking place. Their mental state is being affected hugely, and it is one area that the government, everyone should look into. How do we give psychosocial support to our health workers? What are some of the things they are facing, they're faced with? One, I'm going to work. What are the chances that I will not get infected? It's a fear. That is one. Whether or not the equipments are provided, they need to psych themselves and believe that I'm going to go in, care for this patient, and I'm going to come out without being infected. We cannot overrule that. Fear is going to creep in. That's one. Two, what is the assurance that I will not pass this on to my family? So they have that fear as well. They have the fear of stigmatization. Just yesterday, I came in contact with a young girl, and the minute she saw me, she just remembered, oh, Julie is a nurse. And I said, hope you are not just coming from the hospital. So there's that fear of stigmatization. It's going to affect them. What is going to be my experience going forward when people know that I work in a hospital? Are people going to go away from me? Are they going to run away from me? So they have that fear. They have the fear of, what if I die? What if I die? Who is going to take care of my family? What is going to happen to my family? What's going to happen to my work? So there's a lot that is going on. And then the workload as well. Now, they are also afraid to speak out. We got a call from a particular nurse who spoke out about the condition of their healthcare facility. And this nurse was being threatened by the HR. So some of them wouldn't want to speak out. So there's a lot going on, and they're having to deal with that. So there has to be provision to render psychosocial care to these health workers. Another area is where they see one person come into the facility. After 24 hours, the person is gone. More devastating is the fact that these people cannot have contact with their families. They can't say goodbye. So medical practitioners are finding themselves as the intermediaries. So they are having to tell families goodbye on behalf of patients. It could be heart rendering, it could be demoralizing, it
All right.
may not even prepare them to face the next patient.
All right. One last question, Julie, before we let you go, is the government has said that it is going to provide our healthcare workers with some level of insurance, provide insurance. I'm certain you would have seen that report. How much impact would this make on the welfare of healthcare workers?
Well, we do not know how much would be. We really can't quantify life or put a value to life. But I must commend the government for making effort. It's going to alleviate some kind of suffering and fears on the part of the health workers. But I would say that apart from the insurance, any other way that the government should show that they care for their health workers, all means should be deployed. The money is one. Yes, the insurance is something good, but is it going to take care of is it going to replace them when if it happens that they get affected or they get infected and they eventually pass on? It's commendable. It's okay. It's going to alleviate some fear, some concern. It's going to bring some form of motivation and inspiration to want to go back to the front line and render this care. But in addition to that, I will strongly suggest, advise that whatever means possible to keep these health workers motivated to sustain their courage in fighting this pandemic, all these quarters should be deployed.
All right, Julie Mogbo, thank you so much for speaking with us on TVC Breakfast. Well, joining me via Skype is Julie Mogbo, Director of Family Health at Litnos Africa International Foundation. Julie, thank you for joining us, and thank you so much. I'll lend my hands again this time to say thank you for the efforts that you have been making, and every other person as healthcare workers across the nation, to help curtail and also take care of those who have contracted the virus. Now, the president, in his statement, while he was speaking to Nigerians, called healthcare workers our heroes, just like we see in other countries. I wonder how that made you feel, and does that imply that we will begin to see some level of changes with regards to the welfare of healthcare workers?
Honestly, I felt really good because I recall waiting to hear him say something similar when the year started, being that it's the year of the nurse and the midwife. But I didn't get that, and I didn't feel good about it. But hearing that from the number one would send good messages to the people, especially the health worker. So this shows that he recognizes and appreciates their efforts and their sacrifices and the contributions that they are bringing to the table in fighting this pandemic. So I believe that it's an open door. It's an indication that there are better things coming.
And perhaps you saw the report that the president talked about the monies being gotten from the EU now. That's about 21 billion naira will be used to rejig the healthcare sector. You are in that sector. Talk to us. What would you like to see the government do with regards to this rejigging it is talking about?
The first thing is to upgrade the existing facilities. They should be up to standard. Equipment should be made available. Then they should invest hugely in the training and retraining of healthcare workers. It's important that we have different specialties. The pandemic has opened up a kind of Cancun homes, and we have seen where there are gaps within the healthcare industry and the healthcare system. We've seen how weak it is. So it's a time to start engaging in strategic discussions on the next line of action while we are combating and while we are curbing the spread of the COVID-19. There should be meetings ongoing as to areas that these monies will be channeled into. And like I said, there should be an upgrading of existing facilities, one, and then two, look at areas where there aren't any facilities and get them established. Three, let's empower the health workers. Let's train them. The specialty areas that we are yet to have, if we have to sponsor them to go out to have these trainings done, acquire this education and competency, let's do that. If we have to bring in the experts to train our own people here so that they can cascade the training, and step down the training, that can be done as well. Training is important. Right. There are different specialties. These are the areas that can be looked into.
All right, Julie, we have had to deal with some other form of issues, health-wise, public health issues. We'll talk about the Ebola and the likes. Are there lessons that we can learn when we're talking about taking care of healthcare workers at this time that we can apply?
Yes, of course, there are lessons to learn, and although we haven't faced COVID-19 before, we have experienced other ones. Now, the lessons are these. What is the system put in place and the monitoring system put in place to ensure that the necessary precaution that has to be taken are strictly being adhered to? There are guidelines that the World Health Organization has put in place. That's the risk assessment and management guidelines have been put in place. I do not know to what extent this is being practiced. So there has to be an assessment by the health worker, an assessment by the patient that would determine the kind of preparedness, the kind of PPE that the health worker should don on before assessing that patient. The health workers themselves, there has to be a monitoring to ensure this spread is ongoing because of the contact. So there's a need to trace how is this being spread. Are the health workers adhering to precautionary measures? Are they adhering to the hygiene measures? What we need to do to ensure that we are clean and safe before we either handle a procedure or handle a patient. These are some of the things that need to be checked. Then we were able to manage Ebola. We're able to contain it within a short period of time. This is almost going beyond what we can handle. If we could do that, what happened? I saw a synergy. I saw a collaboration. There was a collaboration between the private and the public sector. I'm not seeing much of that today. I was a bit concerned when I heard the health minister say that people shouldn't go to the private facilities. I don't know on what basis the statement was made and how practical that is if we can stop people from accessing the private sector. What I'm looking at, we should learn from this. How did we combat Ebola? We had everybody work together, and I think that same method should be deployed. Let all sector, private, public, those that are the NGOs, the community workers, everyone come to the table. Let us think and strategize on how we can combat this. It's not a one-man show. It has to be everybody, all members of the health team, and even those that are related to the health team should come together.
All right, Julie Mogbo, we have to leave it at this point. Thank you so much for speaking with us on TVC Breakfast.